Hi, my name is Kelsey Hodges, and today I'm going to be evaluating a patient's resting blood pressure. And so, first thing that has to occur is I have to go over the 4 different pre-participation documents that a health professional must go over with the patient before performing any tests or exercise tests. So the first one is the informed consent form, which basically just goes over the different risks that are involved in the test and the possible risk factors that the patient might endure during the test. And so really the whole objective of that document is to get the patient's consent in doing the test and for the health professional to do so. And so at the end of it, it requires the patient's signature, and if the patient's not over 18, it requires the parent's signature and then the physician of the patient's signature as well. And so the next document is the PAR-Q Plus in the 2019 version, and really it's 7 questions involving the patient's health. So it goes over if the patient has any previous diagnosed heart conditions or chronic health conditions that may prevent a health professional from doing the test on the patient. And so things like if the patient experiences pain in the chest during physical activity, and if the patient has ever been prescribed any medication that allows them to act in physical activity. And another thing is if the doctor prevents the patient from ever acting in any physical activity without it being proctored by a professional. And so the third document is the medical family history form, and really the whole purpose of that is just for the doctor to be able to assess if the patient is at risk based on previous known family conditions like heart conditions or any pre-existing factors like asthma or things like that. And then the last document is the algorithm, and really the whole purpose of that is to use a step-by-step analysis to understand if the patient needs further clinical evaluation or if the patient is cleared to do any physical activity. And so those are the 4 documents needed for pre-existing testing. So the next thing I'm going to do is I'm going to ask the patient for consent for touching them and using them to take the blood pressure. Do you have consent?
Yes.
Okay. So the patient has been sitting here for 5 minutes and has had his back against the chair and his feet are flat on the ground. And so I'm going to place the cuff on the 80% of his upper arm and 1 inch from the antecubital space. And I'm going to be taking 2 readings, and so from there I'm going to take the average of the 2 to determine his average blood pressure. And I'm going to place the stethoscope on the brachial artery and hold it down with my index and second and middle finger. Okay, and so the first reading was 115/70, And so now I'm going to wait a minute to allow the patient to rest, and then I'm going to retake the blood pressure. And on a side note, to properly get the maximum inflation level of the patient, you just take the initial systolic pressure that I got of 115, and then you add 20 milligrams of mercury per second, which would be 115 plus 20, which would be 135 as his maximum inflation level. Okay, so it's been a minute, so now I'm going to take his blood pressure again. Okay, and that was 117 over 68. And so if I take the average of those two measurements, the average blood pressure for the patient would be 116 over 69. And so the rate at which I deflated the pump was 2 to 3 milligrams of mercury per second, and the difference in taking blood pressure at resting and during exercise is that the deflation rate would be 5 to 6 milligrams of mercury per second, and you would take it while the patient is on an exercise machine. Okay, and with that being said, blood pressure is affected by different risk factors such as unhealthy food and drinking habits, sedentary exercise behaviors, and faulty, health equipment and possible technician error. So those are some factors that could affect blood pressure. And then the different blood pressure categories, the low is where the systolic is below 90 and the diastolic is lower than 60. And then a normal blood pressure is systolic is less than 120 and the diastolic is less than 80. And then the third stage, which is pre-hypertension, is when the systolic is less than 120, between 120 and 139. And then the diastolic equals to about 80 to 89. And then the fourth stage is the first stage of hypertension, and the systolic is between 140 to 159, and then the diastolic is from 90 to 99. And then the last stage is stage 2 of hypertension, which is where the systolic is anywhere equal to or greater than 160 milligrams of mercury per second, and then the diastolic is anywhere between plus or equal to 100 milligrams of mercury per second. And that is all. Thank you.